Today we're doing a video on the treatment of sciatic pain. Patient E has sciatic pain in both legs coming from a bulge in his lower back. Does it go down the side or the back of your legs?
Yeah, more down the back.
More down the back of the leg, so obviously sciatic associated with bladder channel, typically a problem between L3 and L5. So what we're going to do is you can feel the pain in his legs now. We're going to put the needles in, get him to move around, see what kind of results we get. So here we go. So we're using master tongue points here. These ones here are absolute killer for sciatic pain. They work very well. Obviously sciatic pain is a symptom. The problem is itself is in the lower back. So we need to treat the lower back as well. These are other tongue points. This is my favourite combination for treating sciatic pain because he's got it on both sides. We do it on both sides, but typically we would do the hand opposite to the leg. That's the problem. Found insertion down here. These needles hurting?
I need just a fraction.
Just a fraction, bit of a tingle. Alrighty, so we're just going to get you to hop up and have a walk up and down the hallway, wiggle your hips, get your knees up, get a bit of movement in there, nothing too dramatic, yep. And we'll see how you feel. The reason why we get the patient to move around is it's a chi moving technique. Stagnation in the lower back, that stagnation needs to be alleviated so that it can go back to normal and the pain can be alleviated. And so the easiest way of doing that is just to get the patient to move around naturally. And often, if the back's out or the back's spasmed, it'll loosen itself off. And how's the pain?
It's all right at the moment.
Can you feel it at all?
Nah, just a slight tingle in the right leg.
All right.
Yeah.
So we'll manipulate this a little bit. Another walk, please. Thanks, mate. Typically those points are enough, but if by the second time he comes back it hasn't completely gone, then I'll add a couple of needles into what we call expand the image. When we're talking about the image, we're talking about holographic image associated with tools. Acupuncture, the hand is the foot, forearms, the lower leg, and so on. Is it gone?
Yeah, it's still tingle a little bit in the right.
Just a little bit. Yeah. All right. I'm just going to have one more
just down the right.
In. So what? Lower down here.
Yeah, it's more. Yeah, it's down
more
in there.
In there. All right. Cool. So this is the upper. This is the lower. Try that. This style of acupuncture should have immediate results. If you're doing it and you're not getting immediate results, in my book it's because you haven't got the needles in the right place. You should keep on looking until you do. Bit different? It's gone?
A little bit different.
Gone tidily or still?
Yeah, just slight.
Just a tiniest little bit?
Tiniest little bit, not a lot.
Alright, we might just pop one more in here. Alright, try it again. I went and did a Bob Doan seminar and he said you don't need to only use a couple of needles to look clever. It's your responsibility to get the job done. If you need to use more needles, do it. So that's what we're doing. So I have no shame in using more needles than what I was taught at school.
It's better.
Better? Fantastic. All right, have a seat. So in this instance now, we're just going to add a guiding point on the feet there. We're going to use ladder 65. Reason being, it's because the shoestring points are associated with heaviness and aching in the joints of the associated channel. And in this case, because the pain's predominantly on the back of his legs, we're using the bladder point. To be honest, I always like adding a couple of kidney points for the lower back as well, just to help secure the treatment. to be honest, kidney 3, acute or excessive lower back pain, just put in there every time. It's dynamite. All right, thanks very much for watching. Have a great day.